thank you so much for joining us for another educational webinar here at Well Beyond Breast Cancer. Today's webinar is Management of Cancer-Related Fatigue with Dr. Palencia. We are super, super excited to have her here. And this webinar is generously sponsored by A Domani, and we have Katia here, who is the founder. So before we get into all of the good stuff, just a friendly disclaimer, as always, everything presented here is educational and informational purposes only. Sorry about the dog. So just be mindful of that. If you have specific concerns, please reach out to your healthcare team, and they will be able to provide you with the best guidance. So if you don't know who I am, I'm Amanda. I am the founder and executive director of Well Beyond Breast Cancer. And Well Beyond Breast Cancer is a nonprofit organization that's dedicated to really improving the quality of life of the breast cancer community. And we primarily do this through two programs: a financial assistance program, where we help fund appointments of physical and or occupational therapy with therapists who are specialized in breast cancer rehabilitation. And this is a program that we offer nationwide, where we're partnering with incredible therapists. We also offer educational webinars and workshops, so exactly like these. So every month we do a deep dive on a different breast cancer related side effect to help you understand what's going on in your body, possibly self-manage a little bit of that, and understand the resources and options that you have available to help. So, like I said, this webinar is generously sponsored by A Domani, and Katia is here. She is the founder, and she will explain exactly what A Domani is. So, Katia, I will hand it over to you.
Thank you so much for that very sweet introduction, and just such a pleasure to be here and to work with your incredible organization. I'm Katia Ecker. I'm the founder of A Domani. This is a line of sleepwear that I initially had started because I had terrible postpartum night sweats, and then I realized that we're all really kind of suffering from night sweats for so many different reasons as women, from postpartum to menopause, but also from cancer-related treatment. And I really saw it firsthand because right after I launched the company, my mom was diagnosed with metastatic breast cancer. And the line that I created is made out of very skin safe, skin sensitive materials that really support your skin barrier health and also keep you dry, cool, thermoregulated when you're wearing them. And so these are the garments that my mom actually wound up wearing while she was in treatment. It was a very, very aggressive cancer. She died 6 months later, but she wore the garments throughout her entire treatment and eventually hospice, and wherever the fabric touched her, the skin barrier stayed intact. So I knew all of this when I developed the fabric, but when I really saw it in practice on the person that was most important to me in life, but this became like a very locked in mission for me. And there obviously there's lots of different applications to it, but this is a community that is like very near and dear to my heart, and just like very thankful to be trusted and supported by this community and create a product that really supports you in your journey. And everything that we produce everything from 10-cell live cell microbiome dowel, these made in Portugal, and all of the materials are naturally antimicrobial, supporting your skin barrier. They're hypoallergenic. They don't pill. They wear beautifully, and they're just designed to be like beautiful basics that are meant for sleep, but that's something that you can wear in and out of the house that just support you and feel really good on the skin and look beautiful too.
Amazing. Thank you so much. We're so grateful to have you here, like I mentioned, and such an amazing product that can help, honestly, so many women through different stages of life, which I absolutely love. So now I have the honor of introducing our speaker, so Dr. Palencia. She's an incredible physical therapist, specializes within this field. And so she is here really to do a deep dive on cancer-related fatigue. So I will hand it over to you so that you can present all your wonderful information.
Amanda, thank you so much for having me here. My name is Dr. Palencia. I am a clinician, educator, and researcher. That's my professional headshot there. So I've been actually a physical therapist for over 20 years, but I specialize in oncology in the last 5 years because this population is very dear to me because my mom was actually diagnosed with tongue cancer about 5 years ago. And so I know what it's like as a caregiver to provide for someone who had cancer. She had underwent tongue surgery as well as chemotherapy and radiation therapy. I am also an educator. I'm very passionate about teaching future physical therapy students. I used to teach at Mercy and currently teaching at Touro University in New York City. I've done research. I've worked with biomedical engineers on music biofeedback. And most importantly, I've done research at Kessler in the breast cancer population. So today I am going to be speaking about cancer related fatigue, and I'm very excited about it because cancer related fatigue or CRF is one of the most prevalent symptoms that I see in my cancer patients. And this can occur at any time during your treatment. It can occur while you had surgery, such as either lumpectomy or mastectomy, or if you're going chemotherapy and radiation, and even so in the advanced stage. And even if your doctor tells you that you no longer have the disease, you can still have cancer related fatigue. So, the purpose, next slide. The purpose of my presentation today is to really define to you what cancer related fatigue is and to describe my role as a physical therapist and what I do on how to assess and manage CRF. I want you to learn a breathing technique and to identify the benefits of breathing and yoga as to how it can improve your energy levels and to learn some the different exercises and safe exercise guidelines for this population and identify ways to save energy. Next slide. So what is cancer related fatigue? What is that? What does that mean to you? Does that mean you had a good night's sleep, but then you woke up the following day and you're just so tired to even do something, even do something that you enjoy, like cooking, or maybe you're a mom and you need to help your kids with homework and that's just so hard for you to do, or even go to work. So the National Comprehensive Cancer Network, that is actually an alliance of top tier healthcare organizations that provides recommendations and guidelines so that patients can get the highest quality of treatment for cancer. They're defining cancer related fatigue or CRF as a distressing, persistent, subjective sense of physical, emotional, and exhaustion related to cancer or its treatment, and it's not proportional to the recent activity and it interferes with functional functioning. So I want you to understand the difference between a normal fatigue versus a CRF. The key word here is that it is distressing, it is persistent, and it can last even after months after you no longer have the disease. And it's present, as I said, throughout treatments and even after the cancer is no longer there. Next slide, please. So, what do you think? Think about it. What percentage of people with cancer experience cancer-related fatigue? Think about that. Think about in your journey. At any point, did you ever have this? Next slide. So, according to this review by Kang et al., that 4 out of 10 people with cancer will experience some sort of fatigue. Majority of them, they will report mild fatigue, but then there is a small portion that will report moderate to severe fatigue. Next slide. How about for the different cancer types? So we could see that the highest prevalent is for those that have been diagnosed with brain tumors, but the second one is the breast. So 1 out of 5 breast cancer patients will report severe fatigue, and there's 43% that will report moderate to severe fatigue. Next slide. So now it's important to note that when you are currently on active treatments, the highest trigger for inducing fatigue is chemotherapy. So I remember my mom, when she had chemotherapy, she was just so tired. She just wanted to lay in bed. She couldn't even go up and down the stairs. Next to that is radiation, surgery, and targeted therapy. The good news is that there is some strategies that we can do to combat cancer-related fatigue. So, what are the causes of CRF? So, it could be the cancer itself, like because you were diagnosed with cancer, or as I said, when you're having these treatments, realize that for every treatment that you're getting, there will be side effects, and one of that side effects is CRF, and it can vary from one individual to the other. It could be pain. It could be because you're getting the treatment. It can cause anemia. It could be lack of physical activity or exercise. Maybe you're not eating well enough. Could be the medication. Could be that you're going through so much that it's causing you anxiety and depression, and this can lead to CRF and sleep problems. So I want you to understand that the moment you are diagnosed with cancer, you go in this journey, right? So cancer is a journey. That's what happened with my mom. She went through this journey, and now she's about 4.5 years post cancer free. But in that journey, you're going to be seeing multiple doctors, from your oncologist to your plastic surgeon to radiation oncologist. And this is actually an image that was taken from the Institute of Medicine. And you can see here in the yellow bubble is rehabilitation clinicians. And that is where I fall into. Okay. So that is including physical therapists like myself, occupational therapists, and speech therapists. So what is my role really? So my role is trying to keep you moving and trying to keep you as functional as possible. So on the times that you're having treatments such as chemo or radiation therapy, you might have CRF or you might have other signs and symptoms. And my job is to keep you as functional as possible. Next slide. So what do I do as a rehab professional? So just as you go to your doctors and they prescribe you treatments for the breast cancer, such as maybe you needed radiation, or maybe you needed a combination of lumpectomy and radiation, maybe you needed mastectomy and an implant. My job is to prescribe you exercise. And then we're going to be talking about this, how to conserve your energy. We teach you how to manage your symptoms. We also teach you how to move, even something such as simple as getting up from a chair. Like I had a patient that she had a deep flap surgery where they take the soft tissue and they put it in the breast to reconstruct it. And she was having very difficulty to get up from a chair. So I had to teach her strategies on how to do that. We also refer you to a psychologist, to an occupational therapist, because maybe you might need an adaptive equipment, or you might have lymphedema. And then there's a therapist also that specializes in lymphedema, and also a referral to a nutritionist. Okay. So just realize that when you come, what do I do exactly when you see me? So we go through, you are going to be getting an individualized evaluation and treatment. So when you come and you see me, I'm going to ask you, what type of cancer did you have? I asked about the stage. Did you have chemotherapy? Did you have radiation? I am also going to partner with you as a coach, because I will ask you about your goals. What was your occupation? What are some of the activities that you're having a limitation? For example, I had a lady that I evaluated. She was about 4 weeks post bilateral mastectomy with an expander, and she was not able to blow dry her hair. She was having pain and difficulty putting her shirt on, or even occupations such as returning to work. We also ask those things. I also ask you about your social history, your support system. And also, I ask you, what do you want to get out of therapy? So then I take a bunch of tests and measures, which I'm going to go over, and just realize that I develop an individualized treatment based on your impairments. So maybe your impairment could be, maybe you had chemotherapy and now you have tingling and numbness on your feet. You're having neuropathy and you're having balance issues. So maybe your program might be geared a little bit more to balance. Or this morning, I saw a lady that had, she had lumpectomy with radiation, and she's coming to me because she's having mild fatigue after 9 months, but also she's complaining to me of restricted range of motion and painful range of motion when she has to reach her arm overhead. So her program might be different. It could be more like soft tissue and working more on range of motion and flexibility. Just realize that we always get in touch with your oncologist as well as your plastic surgeon. So whenever I have a patient that have surgery, whether it's an implant or a mastectomy or a lumpectomy, I get in touch with the the director of our rehabilitation gets in touch with the doctors, and we always ask for precautions or anything that we're supposed to be avoiding. So we do work with your doctors. So this is one way we measure your fatigue. So this is a fatigue questionnaire that we give out to our patients to measure fatigue. This is taken from MD Anderson. So it asks about fatigue within the last 24 hours. What is your worst fatigue and what is your current fatigue? And how does fatigue affect you in terms of your mood, in terms of your walking, in terms of your enjoyment of life, and in terms of your spending time with your family? And then we add it up and we divide it. And it's based on a 0 to 10 scale, where 0, there's no fatigue, and 10 is worst imaginable. So 0 to 3, so I'm sorry, 1 to 3, it's mild, 4 to 6 is moderate fatigue, and 7 to 10 is severe fatigue. So if you have moderate to severe fatigue, I highly suggest that you see a rehab professional like myself that is trained in cancer rehabilitation. So now I'm going to talk about the tests and measures. So when you go see your doctor and they monitor you, they take a bunch of tests. For example, they might do a CAT scan to see if the cancer has spread, or they might actually do a blood work after you have chemotherapy. We do also tests and measures. We also measure you. And as I said, our role is time and function. So when you come and you see me, some doctors might even send you at the time that you were diagnosed, but you didn't have treatments yet. And we take these measures. So an example of that is taking your grip. So we can look at the strength of your arm and also your ability to get up. How many repetitions can you get up in 30 seconds? So this looks at your endurance and your overall strength. We look at your shoulder range of motion, and we also take measurements for to screen for lymphedema. So we usually like to do this depending if you're coming for rehabilitation, meaning just at the time that you were diagnosed, but you did not get your treatments yet. We take baseline measures. And then while you're going on your active treatments. So we know that when you are on your active treatments, for example, when you are undergoing chemotherapy or radiation, these measures might be down because you have side effects from the treatment itself. And also we take these measures into survivorship. So we partner with you. Okay. So how do we monitor that these patients are that when we see you, we are being safe with you? So I was trained as a revital cancer specialist at Kessler Rehabilitation, and I went through 6 months of training to work with this population. And there is a very, very specific protocol that we follow. For example, how do we know that when I'm putting you in the treadmill or in the bicycle that you're not out of breath? So we look at your oxygen, we measure your heart rate, we check your blood pressure, and your rate of perceived exertion. That means is if you're doing an activity, if you were to rate yourself from 0 to 10, 0 meaning that you don't have an exertion, and 10 that you're exerting a lot, 4 to 6 is an ideal range. We do this also while you are exercising and then after you're finished with us. So as you come and see us for about an hour, we're constantly monitoring you to make sure we are following guidelines and protocol. So how do we treat CRF? So here are some of the treatments for CRF. So I'm going to go deeper into the type of aerobic and resistive exercises, breathing exercises, yoga, how to conserve your energy, how to manage your stress, and definitely having a positive attitude. So exercise seriously. So you're thinking that, okay, I'm tired and you're asking me to exercise. Isn't that counterintuitive that when I'm going to exercise, I'm going to be tired more? That is actually a myth. That is not true. Exercise actually combats CRF. And now I am going to show you a research about this. So this is a research that was published from the Journal of Orthopedic Physical Therapy, and it's pretty recent, by Dong et al. In 2023. And he and his team ask, what are the type of exercises that can combat CRF? Okay, so he actually looked at 56 trials with over 4,000 patients in it. And as you can see here in this image, that aerobic and resistive exercise is the most superior in combating CRF when at the time that you are getting on active treatments and after treatments. Yoga and regular physical activity is also effective, but that's only effective during cancer treatment. So that means when you're actually undergoing surgery, chemo, or radiation, yoga and regular physical activity are effective to combat CRF. So what is regular physical activity? So that means that definitely not, definitely you try to engage in activities. Let's just say, for example, you enjoy cooking. So it might not be that you have to go to the supermarket and go grocery shopping and then go through the whole thing. It could just be maybe a piece of it, or maybe even just sitting down when you have to cut vegetables. So you try to be maintaining active, or maybe folding clothes and sitting. But in this research, it's also important to take into account that we have to take patient consideration and individualized exercise programs. So meaning that we look at the patient's age also, as well as their response to exercise, as well as their comorbidities. For example, if they have any heart conditions or any other conditions on top of cancer, that has to be also monitored. Okay, so now we're going to talk about what is the difference between aerobic versus anaerobic exercise. So aerobic is cardiovascular versus anaerobic is strength training. So the NCCN is giving this guideline that they want patients to exercise up to at least 150 minutes. But wait a minute, that number is too high, and that's almost like impossible to do that. So even if you start for 10 minutes, even if you actually break it down into intermittent sessions, that is okay. Aerobic exercise can include brisk walking, swimming, cycling, and dancing. So obviously this is dependent on what your function was before and what type of enjoyment you had. So if, let's say, you like to shop, like my mom, she enjoyed shopping. A motivation for that would be, let's say, going to the mall when it's not peak time, and then you could be walking there. Or maybe you enjoyed dancing. So maybe even just turning on an upbeat music and dancing to it, that's considered aerobic activity. Or maybe you like to bike before, so doing a stationary bike could be a start. Anaerobic, on the other hand, is strength training, and this is something that has to be done 2 to 3 times a week, and we want to alternate with at least 48 hours of rest. And this is strengthening the major muscle groups. So that could be like your biceps, your triceps, your quads, your hamstrings. And this includes exercises such as squatting, using resisted bands like Pilates exercises, and light weights. So just so you know that even though this is the guideline, we always follow precaution. For example, on here, you're going to say wall push-up. So obviously, if you just had surgery, we're not going to have a patient do a wall push-up. We always follow the precaution. It might be that after you had a lumpectomy, the doctor doesn't want you to strengthen until after 6 to 8 weeks. Or maybe you might have a mastectomy with an expander placed on, and you might not be able to do strengthening in the exercises for like until like 8 weeks. So we always contact your doctor and we always ask for precautions. So if you got anything out of the first two slides, I want to say that exercise does reduce CRF. Okay, so we talked about this already, the types of aerobic and anaerobic exercises. So for anaerobic, you could do like shoulder press, chest press, bicep, leg extensions, and then leg curls. So there is a program that we do at Kessler, and you can also see other healthcare professionals about this. This is called the Strength After Breast Cancer Program, or also known as the SABC. This was developed by Dr. Catherine Smith. And this is a program. So this is a program that we incorporate after we've already addressed the main impairment. So let's say you had a mastectomy or you had a lumpectomy and you already had a full range of motion and you no longer have, let's say, peripheral neuropathy and your balance is good. We incorporate this later on, and the program is about reducing the risk of lymphedema, because we know that after you had a breast surgery, and especially if your lymph node is sticking out and your BMI is a little bit high, meaning that you might be a little bit above on the weight, that puts you at risk basically for lymphedema. So this program is to reduce the risk of lymphedema. And it is done by a professional like myself who went into training under SABC. And it is a combination of strengthening for the upper body and the lower body, as well as flexibility and core exercises. And the goal is to reduce the risk of lymphedema. And it can be done over a period of 4 to 8 sessions in a 4 to 8 week period. And I actually really like this program. Okay, so this is very important. So think about this for a second. What motivates you to exercise? Do you like to exercise? So they've done a research that this was a classic study in the Journal of Psychology by Ryan in 1997, that extrinsic motivation comes from someone is telling you to exercise or someone is telling you to do it. For example, it could be your doctor or it could be your spouse, it could be your child. But intrinsic motivation is a lot more valuable. That means it's actually coming from you, which means that you find that exercising or doing that behavior is valuable and pleasurable for you. So if it's coming from you and you want to do that, research shows that the adherence and the success is better. So also don't get discouraged. Like if I say 150 minutes of exercise, you have to do it like gradually. So think of it as success is a series of small wins. So the targeted might be, let's say, 150 minutes, but it might take you 2 to 3 months or even 6 months to get there. It could just be chunks of 10 to 15 minutes is what you're starting with to get to the big goal. So I'm going to share to you some exercise tips. So as I said, the 150 minutes that the NCCN is recommending might be too much. So you have to start slowly. And even if you're doing dosing of, let's say, 10 to 15 minutes, that is okay. So let's just say I tell my patients, let's just say you're going to the grocery store. I tell them maybe park your car a little bit farther so you have that extra 10 minutes to walk. You have to listen to your body. There's also this test called the talk test, which is when you are exercising, you should be able to have a conversation with someone, and you want to make it engaging and pleasurable. So you can invite your family or your friends. So you can see in this picture, so my mom there, she's wearing a white coat, and these are my kids. And my mom liked to hike, so we went to a park that was actually close to George Washington Bridge. I live about half an hour from there, and we made it so that it's scenic. We had a picnic, but before we did that, we actually walked for about 15 to 20 minutes, and that was rather enjoyable. So they find that you want to learn and you want to do an activity if it's something that is enjoyable and pleasurable. So always consult with your rehab professionals for individual exercise program. Okay, so now we are going to be speaking about the benefits of breathing exercises. Okay, so you could see in this table here on the left side are the benefits in breast cancer patients, and then the types of breathing. So as you could see that even if you are undergoing treatments such as chemotherapy or radiation, breathing exercises can help. How does that help? It can reduce CRF, and it can also improve your sleep quality. So that is even just 10 minutes of breathing, according to this study by Gundagdu and Koskali. The references are actually in the back. It can also reduce anxiety and overall psychological distress. It can improve your emotional regulation. And then for patients that have undergone radiation, the breathing exercises can actually reduce chemotherapy induced nausea and vomiting. Okay. So if you are somewhere that you're able to sit, I can show you guys a technique that I actually instruct my patients. And this is preferably done in laying on your back, but you could actually do it in sitting. So this is something called diaphragmatic breathing. And what you can do is with your hands and your fingers, you can actually you could put it on your rib cage and in your belly. And when you are inhaling, you're supposed to have your belly is supposed to get bigger like a balloon, and then when you're exhaling it's supposed to be deflating. And the theory behind this is that you're trying to regulate your sympathetic nervous system and your parasympathetic nervous system, so there is a balance. So this is again one of the I love incorporating diaphragmatic breathing in my patients because it definitely helps with emotion and with calming, and it stimulates the parasympathetic nervous system, which can make you be more at peace and more calm. So once you've advanced to diaphragmatic breathing, you can do a box breathing technique where I would tell my patients, again, you could do this preferably laying down. So if any of you actually do yoga, you could do this like with that position called savasana, where you're laying down with your actually palms up. So that is you inhale, you hold for 4 seconds, and then you hold for 4 seconds, then you exhale, and then you hold for 4 seconds again. So that is called a box method breathing, which is actually going around the box. Okay, so now we're going to talk about the benefits of yoga. So this is another a review that is included in this presentation, that yoga is beneficial, especially during the active treatment phase, because it's been shown to improve general quality of life. It's been shown to reduce anxiety and depression and well-being, and also it improves physical functioning and then reduces the symptoms that's related to cancer treatments. So this image is taken from the National Cancer Institute. I don't obviously do all of this, but I may incorporate a couple in my. So the one that I incorporate a lot in my practice is the savasana, where a patient, as I said, lay on their back with their palms up, and then I incorporate diaphragmatic breathing and box breathing with them. And even so, just stretching the neck, because sometimes you can get tightness after a breast surgery. Okay, so now I'm going to speak to you about energy conservation. So, what are some of the ways that you can actually conserve energy? So, one of the theory is called a spoon theory, where pretty much any activity that you have in a day, you have to designate that to a spoon. So, let's just say that working, if you have to work, it might take 2 to 3 spoons. Or maybe when you go to the grocery store, that's another spoon. Or maybe taking care of your kids after school, that might actually be 2 spoons. So you have to, I highly suggest doing journaling, which is you write down your activity in a 14-day period, and then you start to understand from yourself in what day do you did the most activities, and then maybe the following day you're so tired. So I say to my patients, don't cramp up all the activities in one day, but just try to do it um stagger your activities, and also do your activities when you have the highest amount of energy during the day. Okay, so stress management is also very helpful, and everyone has stress, right? And anyone, even though someone may not be diagnosed with cancer, can actually benefit from this. So, what are some of the ways that you can manage stress, which can combat CRF? So, I already spoke to you about diaphragmatic breathing. So, mindfulness, maybe going for a walk outside, such as just enjoying nature, trying to feel the breeze, or um, the birds, the nature, and also the wind. What I like about this also is journaling. So I tell my patients, get like a gratitude journal. When you wake up in the morning, maybe say three things that is positive to you. Even just calling a friend or joining a support group. These strategies have been helpful, and you could see here on the right side the citations. So, if any of you want to reach me, this is my email at fpalencia@kessler-rehab.com. And here's my phone number. If any of you is interested in the Revital program, I put down the link here if you want to contact me, or you could also reach out to Amanda. And here are the references. And now, if you have any questions, I am here to answer you. Thank you so much. And I want to thank Amanda and Well Beyond Breast Cancer for giving me an opportunity to do this.
Thank you so much for presenting today. It's always so incredible to just be able to provide the community with more information about how to support their recovery. So if anyone has questions for Dr. Palencia or even Katya is still here, please feel free to leave them in the chat and we will definitely answer your questions. So we do have a question. How do I sign up to the SABC program?
Okay, so it depends where you live, but I know what you have to do is, so if you are near New Jersey, there's a lot. We have 100 Revital centers. Where is this? Is United Arab of Emirates. I think you have to go to you can maybe find a hospital that has a cancer rehabilitation program, and you have to ask if any of their clinicians are trained in the SABC program. I hope that answered your question.
Yes, thank you. Any other questions? Please feel free to leave them in the chat. I think as we wait for questions, I guess I'd love to ask you one that I often receive from a lot of my own patients is, do you have any tips and tricks for helping people restart exercise? Because I think for a lot of people, restarting is often the hardest. So do you have any tips that you personally give some of your patients other than starting slow?
So I think one of it is identifying so I looked at first is the motivation, right? So if they already have the motivation, that means they want to do it. I feel that the battle is already 50%. Like you've already fought that battle. But the second is identifying the barriers. So it could be sometimes maybe they have to go to work, they have a lot of responsibilities, they have kids. So depending on what it is, identifying the barriers first. And I would just tell patients that you have to schedule it and then put it in your calendar, even for 15 minutes, and try to make it enjoyable with your family or friends. So let's just say that you also want to exercise. I feel that where you feel that you are going to be safe. I know some centers, they like our Kessler, they offer what they call like a step down program. So if they're already safe, they don't need to be monitored. They're coming there and they feel it's safe. But sometimes, let's say some hospitals, they might actually have a gym that is not so, like some patients, they feel kind of a little bit, oh, I don't want to go to that because everyone that goes there are kind of like fit. So maybe a gym that is affiliated with a hospital where there could be ongoing measurements. And definitely, I would say getting a coach to guide you through the process. So just being a Revital clinician, it doesn't mean that I'm seeing you all the time. It could just be a check. It could be like I'm seeing you. You can come and you see me like every month, and then this is your program that I give you. I give you a home program, and then you come back to me if you're sticking to it. So to answer your question, I would say identify first if they want to do it. That's the first. And second is, I would say, is identify the barriers. And then also tell them that this is going to benefit you in the long run.
I love that. So another question we have is, do you have any online programs for breast cancer survivors?
So in our company, I don't think so, but I should really look into that.
Yes. So there are a number of online resources for patients now, that are quite incredible. Whether you're looking for exercises or you're looking for just more resources, like I mentioned at Well Beyond Breast Cancer, we offer these educational webinars, really providing you with information. But I know that there's other nonprofit organizations that have online exercise programs for cancer survivors, and these are provided by different cancer exercise specialists or physical occupationists, or physical therapists or occupational therapists who specialize within this field. So there are so many resources out there. Um, Feel free to email me. I'm happy to connect you with some of these really amazing nonprofits who are offering these sort of programs online. Any other questions? I think we didn't we talked about so much exercise, which is such an important part of combating cancer-related fatigue, but sleep hygiene is so important as well and can play a huge role in how you're feeling day to day. And I know, Katya, this is something that you love talking about. So I wonder if you want to maybe just share a few tips that you have for supporting sleep hygiene.
Thank you so much for bringing that up, because sleep hygiene is one of those things that people think of as like an afterthought. Like, I'm already tired. I've been sleeping all day. I'm ready to go to sleep now. And I saw it with my mom too. It's like this really hits home, because so much of her treatment, she was just so exhausted. So this is just such beautiful information that you guys are sharing. But there is like, I would just really encourage you to break up your routine between day and night and really treat your nighttime sleep as like a very sacred time, um, apart from your daytime sleep, which you will also have likely during treatment. And don't underestimate just like a cool, dark, quiet room, and um, things that are made of natural fibers. Like, so much now is made out of polyester and labeled cooling. So just really look for natural fibers. Everything that we make is made out of tencel and micromodal, but cotton and linen are also good options. And it, like, even just clean sheets. Like, it sounds like such a trivial thing, but like, the allergens just will compound on your system. And just like these tiny little things that you can do: cool, quiet, dark space, clean sheets, natural fibers. And I really love recommending a warm shower before bed. It's just one of those like small tricks that like it dilates your blood vessels, and your body needs to fall a couple degrees in temperature to get you into a space for deep sleep. And so this just helps encourage your body, kind of like tricks it to get there sooner, and just a really nice trick for restorative and deeper sleep.
Yeah, that's such a great trick. I also love teaching my patients diaphragmatic breathing right before bed. When they get into bed, focus on that diaphragmatic breathing. Like you said, really help to regulate the nervous system, get in that rest and digest phase, that parasympathetic phase, to really help with just a lot of the different emotions that we're feeling throughout the day and get our body ready for sleep. I think is just such a nice, beautiful practice. Incorporating it with after the shower, getting in bed. So such great tips. Does anyone
Try to
else?
leave your phone in a different room.
Yeah, yes. Well, if you do think of any other questions, please feel free to email us at Well Beyond Breast Cancer. And if you think of any other questions for our presenters, I will happily forward the questions off to Katia and Dr. Palencia. But thank you so much, everyone, for joining us today. Like I said, these are monthly educational webinars that we do here at Well Beyond Breast Cancer. Again, really just to support your recovery, help you feel better within your body. So our next one is in June, which is a wonderful webinar all on radiation fibrosis syndrome. So something very, very specific, but I know that it affects a lot of people. So feel free, watch out for that on social media for the announcement of when the signups happen. But thank you again, everyone, for joining us. And thank you so much to A Domani, Katia, thank you so much. And Dr. Palencia, it's been such a pleasure having you and just providing so much education to the community. And like I mentioned, this is recorded, so it'll be on our website, but we will see you guys next month. Thank you so much, everyone.